This is very common, much more common than people realize. Up to 10% of the adult population and as much as 2% of the pediatric population. However, in the adult population, less than a third have it severe enough that they need treatment. But that still represents about 2% of the population who have restless legs and are being affected by it and really should have medical treatment for this disorder. Now, as far as what it is, it's a neurologic disorder that presents with both sensory and motor features. We believe it is generated somewhere in the brain, and typically it just causes these very hard to describe, super annoying symptoms that start in the legs but then can spread anywhere in the body. The only way the patient can get relief is to move the affected limb, rub it, or get up and walk. There has to be some type of motion movement involved, or else it's really can be quite terrible. And to give you a little appreciation, if most of us have had some issues with insomnia, you may be stressed or there's noise in the room next door in your hotel and you can't sleep, we can lie in bed, read a book, watch TV, pass away the time at least. But these restless leg patients, they can't do it. They have to get up and walk, sometimes for hours. And this is night after night of both sleep deprivation and having to keep moving. So this can be such a terrible disorder. Well, this is completely diagnosed by the clinical features and asking the patients the correct questions. A sleep study is typically not necessary unless you're concerned about another sleep disorder such as sleep apnea. And you just simply ask them, starting with the first criterion, which is there an unpleasant sensation associated with an urge to move? Then it occurs at rest, and it gets better with movement, and it typically follows the circadian rhythm occurring at night, although when it gets bad, it can be around the clock. And we have a fifth criterion where we want to rule out mimics because we don't want to overdiagnose it. So if someone is a foot tapper and looks like they're moving their feet all the time, it may be due to restless legs, but it may just be that they have a little nervous habit.